Thank you, Madam Chair. Thank you to each of the witnesses. Welcome, Senator Grassley. I'm used to joining you in the Judiciary Committee, but it's good to see you over in Commerce as well. Much like everything in healthcare, the cost of drugs historically has risen faster than overall inflation. Since 1980, per capita drug spending as adjusted for inflation has increased more than sevenfold. And while Americans spend more on healthcare than people in many other parts of the world, we also spend less out of pocket on prescription drugs than those in many developed countries, including Switzerland, Canada, and Ireland. Thus, much of the higher spending on pharmaceuticals is baked into insurance premiums. Insurance companies know that Americans won't choose an unaffordable plan, so they hire a pharmacy benefit manager, PBM, to manage the drug portion of a policy. The PBM manages a formulary, or a list of covered drugs, which gives the PBM leverage to negotiate lower prices with big drug companies. Of course, the relationship between insurers, PBMs, drug companies, and others are complex, opaque, and confusing both to consumers and to providers. It's easy to see why PBMs might be singled out for more government regulation. They are the middlemen who are supposed to be negotiating lower drug costs from the big drug companies, wholesalers, and pharmacists. There's a lot of potential for PBM to make a whole lot of enemies. Whether PBMs are deserving of this scrutiny is a question I hope we can get more answers on today. The other question I hope we can answer is this: do PBMs harm or benefit consumers? The answer should be decided by looking at the economic data across the entire drug supply chain, not just related to PBMs. The bill before us from Senator Grassley and Cantwell, the Pharmacy Benefit Manager Transparency Act, would give the FTC substantial regulatory power over PBMs. It seems the FTC has now become a catch-all agency that Congress and the White House look to regulate complex markets like prescription drugs or gas prices, even when those markets might be reflecting problems caused by other government policies. I've long had concerns with the FTC's vague statutory authority, but at this moment, we cannot ignore the current state of affairs at the FTC. Under Chairwoman Lina Khan, the FTC has gone down an alarming path of regulatory activism and overreach. The extreme partisanship and concerning direction of Ms. Khan's FTC were exposed earlier this week with the announced resignation of the lone Republican FTC commissioner, Christine Wilson, a longtime friend and former colleague of mine when I worked at the FTC. Commissioner Wilson wrote in an op-ed, quote, "I refuse to give Khan's endeavor any further hint of legitimacy by remaining." This op-ed is stunning, and I would encourage anyone interested in the FTC to read it carefully. Ms. Wilson detailed how the agency has lost its way, citing Ms. Khan's willful disregard of Congress's limits on the FTC, including an attempt to regulate whole swaths of the U.S. economy with the agency's first unfair method of competition, rulemaking. It is shocking that a commissioner would choose to resign rather than watch an agency's bipartisan tradition crumble in front of her eyes. Sadly, Commissioner Wilson's departure will now leave the FTC without a counterweight to Chairwoman Khan's activist agenda. I worked at the FTC, and I can tell you that with the agency's overreach and activism, which will no doubt be difficult to sustain in court, it is no surprise that FTC staff morale has dramatically dropped. And so I'm going to approach any bill to expand FTC powers right now, including this one, with extreme caution, especially now that there will be 0 Republican commissioners and 3 Democrats. I'll flag one other concern for the bill. It would prejudge the results of the FTC's current study on the economic effects of PBMs. Last summer, the FTC unanimously voted to initiate a study on PBMs, considering the access and affordability of prescription drugs. Consistent with the current FTC dysfunction, this study has had its controversies. Chairwoman Khan reportedly attempted to skew the study by refusing to study PBM impact on consumers, which is probably the most important question. That departure from standard economic analysis caused major internal disagreement and the resignation of the FTC's chief economist. But thanks to the hard work of the FTC staff, Commissioner Wilson, former Commissioner Phillips, the study was greatly improved, and I'll be closely monitoring it to ensure, in light of the turbulence at the FTC, that it's conducted objectively. I think we should wait on that study before legislating, and I look forward to this hearing to shine further light on this complicated and important question.